Ageing is often spoken about as though it is something to fight, reverse, or fix. I do not see it that way. Ageing is a normal biological process. It's not a flaw and it's not a failure. The problem is not ageing itself. The problem is that many people are taught to think about ageing in extremes. They are told that either they have to do everything or do nothing. They are told that looking youthful means looking tight, lifted, smooth, or different. In reality, most people do not want to look like someone else. They do not want to look done. They want to look healthy, consistent, well rested, and like themselves, just better. That is the philosophy that I use in aesthetic medicine. I do not treat ageing as something to erase. I treat it as something to manage thoughtfully over time. One of the biggest mistakes people make is assuming that ageing is caused by one thing. People often think ageing is simply volume loss, or skin laxity, or lines, or pigmentation. But ageing is not one process. It is multiple processes happening at the same time. Skin becomes thinner, collagen decreases, elastin changes, fat pads shift, bone structure changes, muscles pull differently, inflammation accumulates. That means there is rarely one single treatment that solves everything. This is where many people go wrong. They chase one issue in isolation. They chase jawline definition, or under eye hollows, or skin tightening. But the face does not age in parts. It ages as a system. Good aesthetic medicine means understanding what is changing first, what matters most, and what can be left alone. I tend to be conservative in the way I approach treatment. That is not because I do not believe in treatment. It is because I believe that restraint usually ages better than intensity. The face remembers repeated intervention. When too much is done, too quickly or too frequently, the outcome often becomes visible. You start to see heaviness, distortion, loss of natural movement, features that no longer match the rest of the face. We've all seen those patients with huge cheeks or big lips. Aesthetic medicine should not look impressive because it's obvious. It should look impressive because it's difficult to see. The best outcomes are usually subtle. They make someone look healthier, fresher, more rested, but they still look like themselves. We always say everyone should notice, but no one should know. That's why I often say that good aesthetic medicine is about support, not necessarily transformation. If there is one thing I think is underestimated in aesthetic medicine, it is skin quality. People often focus on volume, structure, and shape, but poor skin quality can make even a structurally youthful face look really tired. Healthy skin reflects light differently, it moves differently, it behaves differently. Collagen, hydration, elasticity, inflammation, texture, and pigment all affect how a face looks. That is why I often prioritise skin quality before doing anything else. Because if the skin itself is unhealthy, adding more volume or trying to create more lift often does not create a better outcome. In some cases, it can make ageing even more obvious. When the skin improves, the whole face looks better. Not because it looks dramatically younger, but because it looks healthier. Not every concern should be treated. Not every request is appropriate. And not every intervention will improve the outcome. Sometimes expectations do not match biology. Sometimes the risk outweighs the benefit. Sometimes the best option is to wait. I think saying no is an important part of good medicine. And it's certainly an important part of great aesthetic medicine. A consultation should not be about finding something to do. It should be about deciding whether something is appropriate in the first place. There are times when doing less produces a better result, and there are times when doing nothing at all is the right decision. If someone wants to age well, I think that they should focus less on chasing trends and more on protecting the quality of their tissue over time. That means looking after skin health, managing sun exposure, supporting collagen, avoiding unnecessary inflammation, being cautious with aggressive treatments, prioritising consistency over intensity. I think people should be very careful about trend-based treatments, doing something now because you've just seen it on TikTok or Instagram. Trends are designed for short-term attention. Faces are designed for long-term ageing. What looks fashionable now may not look balanced in 5 or 10 years. The goal should not be to chase the most dramatic result. The goal should be to still look good in the future. Ultimately, my philosophy is simple. I do not believe ageing should be feared. I do not believe aesthetic medicine should make someone look different. And I do not believe more treatment automatically means a better result. I believe in respecting biology, supporting tissues, prioritising skin quality, and planning long term. We should avoid extremes. We should help people look like themselves, because the best aesthetic outcomes are usually the ones that nobody can quite identify. Patients should just look healthy, well rested, consistent, and like themselves.